Dr. Asch, using behavioral economics to improve individual and population health is fascinating. Can you tell us a little bit about this approach?
Sure. Well, behavioral economics is a relatively new field, or at least it's a new name for a field that's been around for a while. And it grew out of the view that a recognition that the kinds of decisions that humans make are often irrational. Everyone knows that they're irrational. They think their spouse is irrational. But in fact, we all are. But we're irrational in highly predictable ways. And so it's the predictability of our irrationality, the kinds of errors we repeatedly make, that allow us to create new strategies to help us not make those errors. And so an example might be this. You're on a diet. Someone offers you a piece of luscious-looking chocolate cake. It's sitting right in front of you, and we know that that's incredibly motivating because it's right in front of you, and the weight loss can be moved to the distant future. You know exactly where that piece of chocolate cake is going. It's going down your throat, then it's going to situate on that part of the body where chocolate cake tends to go in you, and yet you can't pass it up. And that's often because the immediacy is so powerful and distant events are so distant. And so the approach in behavioral economics is, how do we move those benefits of not eating the chocolate cake more into the present so they can compete with the urgency of having that piece of cake?
What are some easy ways physicians can incorporate behavioral economics into their practice?
Well, so looking for easy solutions with behavioral economics isn't necessarily so easy, because I would have to say that in my own experience, so many of the things that I thought were going to be slam dunk successes, when we do an experiment, they often don't work exactly as we thought, and only in retrospect do we realize what kind of mistake we made. And so I'm a big fan of experimentation and evaluation to make sure that we get it right. But one of the most powerful things that physicians can often do right now is to change the default. Instead of posing the question about what would you like, for example, making the suggestion, this is what we all often do. And in fact, social norming, the idea that people are most motivated, believe it or not, to do what everyone else does, we're much less individualistic than we thought, is often an incredibly powerful tool to get people to do things. So if you were to say, look, most of my patients do this, or this is what I recommend, or any number of things that actually physicians are often very comfortable with, helps patients often get to where they want to go with their own goals. It's not necessarily paternalistic, because you're helping patients achieve the goals they fundamentally want to have. It's not to achieve your goals, but helping them to achieve their goals. And those kinds of default options, that kind of social norming, can be very effective motivators for physicians to encourage and improve patient behavior.
Studies are ongoing to better understand this approach. What do you see as the next steps in implementing behavioral economics into practice?
So the idea of communicating with your patients different approaches is something we could do right now. But the real scalable need for changing patient behavior on a population level is going to require technology. And so currently, if a company develops a medication that will improve the treatment of hypertension or improve the treatment of GERD, a pharmaceutical company might develop that medication further and promote it and market it, and physicians can prescribe it. But until we have scalable technology platforms that allow us to touch our patients in their everyday lives and motivate them that way, we won't have success. Now, we are getting there, and so almost everyone has a cell phone near their person, and increasingly those cell phones are smartphones. And although smartphones are largely adopted from the top of the socioeconomic status down, increasingly everyone, or pretty soon we hope that many, many more people will have smartphones. Those smartphones have incredible amounts of ability to touch people, engage them, and be used effectively for motivating positive health behaviors. As soon as we get the patterns down and the technology right, I'm very optimistic of this moving forward.